Hello, I'm Dr. Srishti Patodia. I'm a consultant with critical care medicine with Apollo Main Hospital, and I'm going to talk to you about acute diarrheal illness. So, what is diarrhea? Now, according to the WHO definition, diarrhea refers to the passage of 3 or more loose or watery stools per day. It can also refer to an increased frequency of passage of stools compared to the normal for the patient. So, we have 3 types of diarrhea. It can be acute watery, acute bloody diarrhea, or persistent diarrhea. Acute watery diarrhea refers to the passage of watery stools, like what you commonly see in cholera. Acute bloody diarrhea is what we call dysentery. Now, persistent diarrhea refers to diarrhea which has lasted for 14 days or longer. So, now that we know what diarrhea is, now we come to the approach to diarrhea. Now, I've taken this flowchart from the Harrison's Manual of Medicine. If you look at this flowchart, basically if any patient presents to you with diarrhea, nausea or vomiting, we assess the severity and the duration of symptoms. If the severity is mild or the duration is less than a day, then you just give them oral rehydration salts and observe. However, if the severity is higher or if the patient have any of these following symptoms such as increased duration, presence of travel history, tenesmus, appearance of blood in stools, increasing frequency of bowel movements, severe pain, history of antibiotic therapy, then in these patients you take a stool and examine them for WBCs. Now, why do we do that? Because that helps to differentiate those patients who require antimicrobial therapy versus those who don't. If there are no WBCs in their stool, then we just go ahead, give them supportive care and wait and watch. If there are inflammatory cells or WBCs, then it is very likely it's caused by bacteria such as Campylobacter jejuni, Shigella, or even by Clostridium difficile. These patients are the ones who require antimicrobial therapy. If, however, there are parasites seen in the stool, then they require antiparasitic therapy. So, one of the very important things that I would like you all to remember is that bacteria do not account for a very high number of cases of diarrhea. Most times, diarrhea is self-resolving and resolves spontaneously without the need for antimicrobial therapy. Now, the thing with antibiotics is that antibiotics can be used to treat diarrhea and antibiotics can cause diarrhea. So, when are we going to give antibiotics in diarrhea? If the patient presents with high-grade fever, if they are looking very toxic, if they have severe pain abdomen, if they have bloody diarrhea, or if they come with a complication such as perforation. Now, as the evidence clearly states, most causes of diarrhea are viral in origin, not requiring antibiotics, and they usually spontaneously resolve. The exception to this is traveler's diarrhea, where the disease-causing organism is almost always bacteria, hence justifying the use of antibiotics in spite of the risk of adverse effects. So, which antibiotics would you give? Well, you can use fluoroquinolones such as levofloxacin, ofloxacin, ciprofloxacin. You can use macrolides such as azithromycin or even rifaximin. So, how do antibiotics cause diarrhea? Now, if you look at this flowchart, this explains the mechanisms by which antibiotic results in diarrhea. Now, if a patient is on antibiotic therapy, what happens? There is an alteration in the normal intestinal mucosa, as a result of which there are 2 mechanisms which can result in diarrhea. First, there is a loss of resistance to colonization, as a result of which there will be an abnormal growth of pathogenic organisms such as Clostridium difficile, Candida, Salmonella, and all of this will result in toxinogenic diarrhea. The other mechanism, there is an altered metabolic function of the flora inherently present in the intestine, as a result of which there can be a diminished digestion of non-absorbable carbohydrates, which can result in osmotic diarrhea. So now we know how to treat diarrhea which requires antibiotics. But can antibiotics cause diarrhea? Yes, it can, and that is referred to as antibiotic-associated diarrhea. So these are the major infectious agents seen causing antibiotic-associated diarrhea. You have Clostridium perfringens, which can cause necrotizing enterocolitis. You have Staphylococcus aureus, which can cause food poisoning, diarrhea. We have Klebsiella oxytoca, which often presents as hemorrhagic colitis, and of course, Clostridium difficile. Now, Clostridium difficile accounts for 30% of antibiotic-associated diarrhea. With this, I come to the end of this session. Now, these are the references from which I took data for this session. And here is a list of recommended reading for you all. I hope this session was useful to all of you, and I hope you enjoyed listening to the session. Thank you.